Welcome, everybody. Welcome to our 25th anniversary celebration. I'm Vanna Boghossian. I'm the Patient Care Manager of Labor and Delivery and Interim Manager for Postpartum Mother-Baby Care Unit and Clinics. And I'm also the honored to be the co-chair of the 25th Anniversary Steering Committee with Suzanne Halsworth from the Foundation. Wave, Suzanne, so they can see you. Before I begin, I'd like to thank the incredibly talented CV Glee. I'm not sure if you're aware, but they have come together very recently to audition for Global TV's Canada Sings. And out of 1,000 people who have entered across the country, our own CV Glee is now in the top 25. And we're going to find out next month if they've made it to the final 12 teams to compete at a national level. Congratulations, CV Glee. We're all cheering for you. Good luck. Today is certainly a day of celebration, and I'm thrilled to see so many people here to commemorate this milestone, our 25th anniversary. In addition to many staff, patients here, there are a number of very special guests I would like to welcome. The Honorable Mr. Harinder Thakkar, Minister of Government Services and MPP, Mississauga Arundel. Mr. Bob Delaney, MPP, Mississauga West. The Honorable Mr. Navdeep Bains, Mississauga Brampton South. The Honorable Mayor Hazel McCallion, City of Mississauga. For those of us who've been part of this community for 25 years or more, we have witnessed firsthand the evolution of Mississauga. I've lived in Mississauga since 1978, and I can recall the day that I saw the sign on the corner proclaiming that this was the site of a new hospital that was going to be built here. As a nurse and a young mother, I was thrilled with the prospect of working at my local hospital. In fact, this morning I pulled out this letter that's dated October 13th, 1984, that was a response to my application here at Credit Valley. And I just realized this morning that that was 5 days after my third child was born. I had established my roots here in Mississauga, raising my family, and I was excited about the idea of living and working within this community with like-minded individuals who are driven to improve health care for this community. Those early days before the hospital opened on November 5th, 1985, were filled with anticipation, passion, and dedication. I was working alongside physicians, nurses, and administrators planning the development of this new modern healthcare facility. We all came from different backgrounds and we had different experiences, and for sure we had different perspectives on the way things should be, but we all decided that we were going to develop the Credit Valley way of doing things and set a new standard, and we were committed to creating this new standard for our community. As Mississauga continued to grow, so did Credit Valley, and so did the opportunities for those staff who demonstrated a willingness to learn. I am proud of my 25-year history at Credit Valley. In fact, there's 113 employees still employed at Credit Valley that have been here since the beginning. And we're all wearing this little pin that says, "Where were you 25 years ago?" I was here. I think that's extraordinary. As a nurse in labor and delivery, I was privileged to care for expectant mothers and welcome their babies in our community. I remember the day 25 years ago when we welcomed the first baby born at Credit Valley, Steve Grigoropoulos. My husband helped me say that. As you can imagine, there's a lot of excitement and enthusiasm about delivering our first baby, and now we're celebrating again as we welcome the first baby that was born on our 25th anniversary. Mr. and Mrs. Chang welcomed their baby this morning, a baby boy, at 0011 hours, and they're resting and happy and healthy up on the postpartum unit. As much of today is about Credit Valley Hospital, it is also about our patients and the families that we serve. And we are honored to serve you and to celebrate with you today. Before I introduce our first speaker, I would like to also acknowledge the dedicated support of our steering committee and working group. So if anybody's here from the steering committee and working group, could you just raise your hand and wave it, because you really deserve a round of applause. We have a full day of activities today, and it's all due to the working team and the steering committee that these activities have come together. So their efforts and commitment to this event have been inspiring. Thank you.